Hello, I'm Pearl Venema, Chief Executive Officer of Hamilton Health Sciences Foundation. Life during the COVID-19 crisis can be extra stressful for many in our community, including children and youth. Providing mental health services for young people is more important than ever. Lori Issenman is the Director of Child and Youth Mental Health at McMaster Children's Hospital, and Dr. Paolo Pires is the Clinical Director of Child and Youth Mental Health at McMaster Children's Hospital. Today, they'll be speaking about changes to mental health services for young patients during such uncertain and rapidly evolving times. For today's episode of Innovations in Vital Care, it is my pleasure to introduce Lori Issenman and Dr. Paolo Pires.
So happy that we're able to do this.
No, this is kind of a nice thing, actually. We've been, Paulo and I have been working together for, 6 years, and this is our first tag team doing a presentation. So I will defer to my colleagues' expertise around mental health. I'm so privileged to work with this guy. So let's start, Paulo.
Yeah, likewise. Thank you. And thank you for the opportunity to talk about child and youth mental health. As folks are probably aware, our pediatric mental health program in the community that serves kind of our most complex presentations is within McMaster Children's Hospital, Hamilton Health Sciences. And of course, the pandemic, COVID-19 really has changed care. Definitely for physical health, but also for mental health. And certainly while we're very concerned about physical health and the mortality rates associated with this virus, as a mental health program, certainly very early on, we were talking about and worrying about the mental health impacts of COVID-19. And so, these are in some ways unanswered questions, but things we've been wondering about. How is this pandemic affecting children and youth and families? Knowing that it's a stressor that none of us have ever had to cope with before. And we know that when there's an additional stressor, that can aggravate mental health issues for sure. And given the population that we serve, where we see youth who are kind of complex in their mental health presentations and who struggle with suicidality, we worried for their well-being, being able to reach out and access care since care can't be in person, and trying to ensure that we had supports in place so that our children and youth were not falling through the cracks and families were being supported. Would you agree, Lori?
I would. Paula, would you agree that we anticipated it as a mental health program that we would see a real surge in presentations to hospital, kids in crisis, and that kind of thing? And, for the most part, we haven't seen that, which isn't to say that there's not impact. But I think that this social cocooning or COVID cocooning that's been happening over the last several weeks may have actually decreased some of the stressors on some of our kids who experience anxiety and school issues, social issues, that kind of thing. So that's been a bit of a surprise, which isn't to say that we are not going to see that as we resume pressures of school opening and that kind of thing.
Well, I would agree, Lori. I think we really didn't know what to expect. And of course, we're always concerned about the well-being of the population that we serve. I actually think there is a subgroup of youth who are actually doing better because the expectations around school were different. The expectations around social interaction, there's so much restriction around leaving the house and not having to interact, that for some young people where that's a struggle, that actually led to them feeling a bit better and doing a bit better currently. And then we have other situations where youth are feeling, very trapped and families are living with each other full time, which when's the last time that happened? And so, that has also increased in some situations, conflict and stress and also worrying about what does the future hold, right? So the more kind of anxious types, this is one more thing to worry about, and having a hard time anticipating when is this going to end? What does this mean for our future? What does this mean for my ability to continue school? So yeah, I think, Lori, you're right. The impact is probably different for different subpopulations, if you will. Yeah. Mm-hmm.
People are living in a kind of a surreal existence, aren't they, in terms of school? And I think we all are anticipating September to be pretty trying for kids and families as those expectations come back.
Mm-hmm.
And I feel like a lot of our conversations around how we're going to support kids and parents and teachers as they get back into that swing.
Absolutely. And I think, Lori, continuing to do so virtually, I think one of the things that has been a great surprise for all of us is that we really have been able to move into virtual care. You can imagine that our staff had great trepidation around this. We didn't know how families were going to be able to engage virtually. And we know that our hospital system and our own program efforts have led to being able to provide care as best as possible. It's not the same as being in the room with someone in our line of work, being able to respond to someone's emotions, being able to, get closer if you need to, express empathy and provide support. It's feels a bit more kind of artificial, but we have worked really hard, I think, to be able to continue care. And in fact, the last time our leadership team talked about this, our visit volumes were actually no less than a year ago when care was not virtual. So that was kind of surprising to us. And I think
I'm really so impressed actually with the efforts of staff who, as everything shut down and people expected to wait for a few weeks to ramp back up, within a very short time, our staff were set up to be able to deliver virtual care. And so the working life of our particular program has changed in how it's delivered, but it certainly hasn't changed in how it's dealing with kids. And so it's good. And I think that we've now actually even started looking at how we can do some groups and how we can actually do some support to parents, that kind of thing as well.
Absolutely, and things are still in development. Being able to do therapy groups, it was one of the main things main activities that we haven't been able to do, and we're starting to venture into. So it's an opportunity really to think about and deliver care in ways we haven't thought about before, right? Because these are the times we're in. Being able to collect information even in advance, we were very paper-based in many ways, and we've moved to electronic ways of collecting information. We've had to, support our staff in being able to do many things virtually, right? So the care that we provide is not just the clinical encounter, but also being able to, access resources, have clinical discussions, and those kinds of things. It really is a team sport, and it's been actually quite gratifying to see how we pull together as a program to be able to continue to deliver the best care we can, given the circumstances. Yeah. So the other thing I think I'd like to highlight that our program has done, as soon as we started working from home and in mid-March, we again became, very concerned about how do we support our community. So we developed a risk support team, and basically one number for our program that anyone could call, a community physician could call if they were concerned and wanted to try and understand what supports were available. So we call this our risk support team. And our risk support team actually meets daily to talk about cases that present to our emergency department and to talk about cases that come to our attention to make sure that kids are connected to service. Because it's harder to have conversations in person with folks, we really put in a lot of effort into trying to create other kinds of conversations that would support kids accessing service. And that's something that's been in existence now since mid-March. We also, I think, with the help of our community partners, really started to have weekly conversations around certain presentations, again, to make sure that kids were not lost in the system, that there were ways for families to reach out and for us to coordinate care. Because we're not the only mental health show in town. We have our community partners in child and youth mental health who work closely together, and of course, who are all providing care virtually. So we've tried to support each other, I think, in providing care and making sure that kids get what they need in terms of mental health care.
Yeah, we are not a standalone operation for sure. And as one of the largest, I think maybe the largest child and youth mental health programs in the province, we have the advantage of having inpatient, emergency, and outpatient and community care. So we're the whole gamut. And also because we're hospital-based, we have got a great staff of psychiatrists, psychologists, social workers, behavior therapists, who are really at the top of their game in dealing with the kids. So the kids that we tend to see are the ones who are at the highest risk. And as Paolo said, we're not the only game in town. We've got really strong partnerships with the community, so that at a drop of a hat, we can reach out to our partners, they can reach out to us and wrap our arms around kids who are really struggling.
Mm-hmm. Yeah, absolutely. I think the other thing that we had great appetite for was actually some HHS wide initiatives around trying to produce some video supports with some information and tips around mental health care and around coping with the pandemic and the current state. So we created actually quite a few videos that you can find on YouTube, and I was so impressed by the number of staff who volunteered and stepped up for this. The videos were meant to be short, but I think, as all of us know, even creating a 2-minute video takes quite a bit of time to pull together the information and do retakes and that kind of thing, and people really stepped up. So that's something I think we're very proud of. We're trying to reach outside our walls, if you will, and try to provide support to the broader community and provide information around mental health and coping with stressors. And internally, we had several of our staff contribute to the resiliency support team, which is also an initiative within HHS to support our own staff who are on the front lines doing the very hard work of caring for the patients that come to our front door with a myriad of health concerns, be they mental health or physical health concerns. And so that's something I think that we're really proud of to have contributed to as well.
I guess what's next is we'll continue through the summer, get ready for the fall. And I think the thing that we've learned is that there is not going to be going back to the old normal. I mean, working life is a new normal. And I think we're going to see a mix between virtual care and face-to-face care. And I think that that's going to give us a wider reach into the community, being able to get to kids and families who have a hard time making the trek into hospital or to the Ron Joyce Center where we do our outpatient work. So I'm kind of excited about the possibilities ahead and how we deliver care. And, the beat goes on, so we'll see what happens.
Yeah, absolutely. And these are conversations, that we're having for sure about how to continue to provide the care that we're providing and do provide care differently, knowing that hopefully we'll be able to provide some in-person care very soon.
Well, thank you so much for that information. That was very, very valuable and interesting information. You had mentioned how the staff had been forced to really pivot and adjust quickly during these times. What was the biggest challenge for you and your team having to adjust so quickly?
I think one of the things that was top of mind was worried about being able to reach some of our young people. like, who uses phones anymore? And so we were really phone based for the first little bit. Certainly, we were able to reach some parents and some youth, and we really had to create a list of who is it that we're absolutely worried about and have to make, lots of efforts to connect with. People were worried they wouldn't be able to provide care to, to their entire caseload. And I think, not everybody, has the benefit of having, the technology of computers and internet and all of that in order to provide virtual care. So I think those are a lot of the anxieties that we experience. And we still are worried about, and are aware of some families who can't benefit from virtual care at this time. So we're struggling a bit to figure out how can we provide care to them, given the circumstances. Yeah.
I think the technology as well. So we needed to get our Zoom game going. We were using, as you said, Paula, just phones originally, and then another media. But the Zoom has been a good thing. But we also had to deal with issues of privacy. And, it's one thing to connect, but how does the kids who really don't want to talk, they don't want to have their conversations necessarily overheard by their family, just dealing with some of those things and building that rapport and that trust, so that kids are feeling that they can feel safe to share their story.
I would agree. And, what's different about, Zoom has been fantastic. And again, we are providing lots of virtual care, but we do have this reality of staring at ourselves now when we're doing Zoom calls. And for some very anxious youth who, who are more of the social anxiety brain, like, being able to connect virtually by video has been quite a struggle. We've definitely had some youth refuse care for that reason. And, when they can opt for telephone calls, that's great. But there's all sorts of things we need to help families and youth navigate in order to successfully provide virtual care. The privacy being another example. Yeah, so hard to find a private space to have a conversation. It's not like we're at Ron Joyce and you can go behind a locked door and there's no one else that's gonna, be knocking at the door, or noise, or whatever the case may be. So we've really had to help people problem solve, using, earbuds and all sorts of things so that their family is not hearing us, over the screen, for example.
I did that.
Well, you mentioned how virtual care has reduced travel time for some people for patients who can receive virtual care as opposed to coming in. Could you speak a little bit to how large of a catchment area you actually serve? I think a lot of people are surprised that patients and families are receiving care, and they're coming in from many parts of the region.
True. We are Hamilton based, but we see kids at Brantford, Haldeman, Norfolk, the Niagara region, Burlington. It's a wide network, and the thing that's interesting about the families that we serve, it's a real urban-rural mix, so that folks who come to our doors from, let's say, a farm in Norfolk have a bigger challenge getting here than kids who can hop on a bus and reach our doors in Hamilton. So it's a big area.
It is. And I would add, even kind of within the city, depending on where kids live, it can be, sometimes it's an hour and a half bus ride to get to us, right, depending on where they live. And so the nice thing about virtual care is it has that potential barrier for some families, has been eliminated, assuming they have, the technological resources and all that to connect. I certainly had one youth say to me, "Oh, if I could have been doing this the whole time, that'd have been great, because it's really hard to leave my house and get there on time, especially." And so and that was surprising for me to hear, but I think it is a benefit for sure.
And I think the final question for both of you is, for each of you, what's the most personally gratifying part of what you do?
For me, it's the team. Like, it's the team. I'm going to steal your answer probably, Paula, but it's the team. I don't have, as the director of the program, I don't have the opportunity to deal with the kids directly or the families directly. I'm a social worker by trade, so my heart is very much embedded in the clinical work, but my role is not that. So I just feel blessed with the team that I work with. The leadership team is smart, committed, enthusiastic, up for challenges, and totally dedicated to the care of the kids. That may sound a little hokey, but it's absolutely true. So that's what puts a spring in my step all the time.
Yeah. Yeah, and I would say similarly for sure. Our leadership team works really well together, and we are a program with many parts. And I think we've always really strived for innovation. It's kind of comes to us very naturally to try and do things differently. When I see the passion and the skill of the frontline clinicians in our program, that is just something I'm very grateful for. We spend a lot of time and have spent a lot of time training staff in evidence-based interventions. And the reality is that, we always do the best that we can with what we have. And there isn't a silver bullet. You do this one thing and someone's going to, get better. We're always striving to provide care differently and trying to improve the interventions that we can offer.
I'll just add to that a little bit. The other thing I'm really, really proud of is I think we have a stronger presence with our community than we used to, and what we've done, we've tried to make sure that our community partners and the kids that they see have access to our very specialized expertise in psychology and psychiatry, if they need that kind of refined opinion or consultation. So I think our doors were a little bit more closed years ago, and now I feel like our community would agree that we're far more accessible, and that keeps us very grounded, as it should.
Yeah, I would agree. We've made great strides working with our community. And again, this is a team sport, internally in our program, but also kind of community-wide. The larger team of our community partners is really important to highlight for sure.
Wonderful. Well, thank you so much for joining us today. That was very interesting.
Very much, Aaron.
Thanks, Aaron.
Thank you. We'll talk soon.
Okay,
Bye.
take care.